What if you could save your natural tooth, even after a severe infection, without pain or extraction? Today, you'll see exactly how root canal treatment works, step by step, in stunning 3D animation. When bacteria invade your tooth through deep cavities or cracks, they reach the pulp chamber, causing a painful tooth infection. If left untreated, this infection can spread to your jawbone, leading to intense dental pain, gum swelling, and even tooth loss. That's why early root canal treatment is so important for tooth preservation. Watch as our 3D animation shows the process. First, your dentist creates a small opening in the crown of your tooth to access the infected pulp. Using precise dental instruments, all infected tissue and bacteria are carefully removed from the root canals. The canals are then cleaned and disinfected with powerful antimicrobial solutions to eliminate every trace of infection. Next, the empty root canals are filled with Gutta-percha, a safe, biocompatible material that seals the space and prevents future bacterial invasion. Finally, the tooth is restored with a strong filling or dental crown, protecting it for many years. Root canal treatment has a 95% success rate and is a proven way to relieve dental pain, stop tooth infection, and avoid tooth extraction. With proper dental hygiene and regular checkups, your treated tooth can last a lifetime. For more expert 3D dental procedures and clear explanations, subscribe now. If you have questions about root canal treatment or tooth pain, leave a comment below. We're here to help you keep your smile healthy.